That's the key. Remember how we process governmental insurances is a little different of how we process commercial claims. We are talking about money, the fees, the codes are going to be the same. The services are going to be the same, but it's how much money we're going to get reimbursed through these private organizations. So that's basically what it is. Now, with these private or commercial insurances, you're going to have a primary, a secondary, a supplemental insurance, which is called a tertiary. See, primary, secondary, tertiary, the third insurance. But most of the time they call it supplemental. Why they call it supplemental? Because most of the time is the insurance that is going to pay for the balance. Let's say that you don't have a secondary insurance. Well, the supplemental insurance plays the role as the secondary, but it's not called secondary. Because secondary is when you got an insurance through your spouse. You work, he or she works, so for that reason, they have another insurance. Supplemental is, oh, my insurance do not cover these services, so I'm going to get another insurance so it can pay for it, because it's a lot cheaper if you have certain pre-existing conditions that getting a supplemental insurance that paying out of your pocket the balance. So that's basically what it is. So it is more convenient to get a supplemental insurance if you have pre-existing medical conditions. If you are taking certain medication, the medications are expensive. You have to receive certain procedures, certain treatments, and these are not covered by your primary insurance, or they pay just a little amount, certain percentage. Now you want to have a secondary, supplemental commercial insurance plan. So it's going to cover for those balances that your primary insurance does not cover. So that's basically how it works. Remember, if you have Medicaid, you're not gonna get a supplemental. How are you gonna get a supplemental? You cannot even get the primary one because you have to pay for it. And Medicaid do not have a supplemental insurance. Medicare does. Remember Part C? That's a supplemental one. Medicare Advantage. Now that's gonna be paid by, the policyholder. But that's a little different. This is a very high premiums. Insurances run in between $7,000 to $25,000 per year. Health insurance, if you get them through these commercial companies. So that's basically how it works. So we really need to pay attention, because this is, remember, very important for you, because when you start working, you're going to be receiving a insurance probably from the organization that you're going to be working for, and then probably you have to pay a balance. Probably you might need to get a supplemental insurance if your spouse do not have insurance. Otherwise, that will work as the secondary, so you don't need it. And if you don't have pre-existing medical conditions, you don't need to get a supplemental. What are you going to get supplemental for? You're not going beyond what is, what the insurance is paying for your services, because you don't have stuff to be covered for. So there is no need. This is only applicable for those families that have, pre-existing conditions, whether the adults or the children. So that's basically how it works. So again, there are many situations, many cases that can be discussed to illustrate how these claims are completed. That's basically how it works. Hello. Someone asked me a question. So be careful, turn your microphones off while you participating in the class, because we don't want to get these interruptions. Okay. So that's how it is. So that's how it works with these commercial insurances. So we're gonna have a form, of course. Remember, those claims are not gonna be CMS 1500 because that's for the government, but they're gonna be using the same format. But these insurances, let's say if it is Oxford, it's gonna say Oxford, like the letterhead. If it is United Healthcare, the insurance on top is gonna say United Healthcare. Blue Cross Blue Shield, Cigna, any other private commercial insurance, they have their own forms. So we have to follow their policies. So when you complete those, you have to follow what they are, what the requirements to join their plans are. So that's basically what it is. Think about you are applying for anything. Different schools, they're gonna have different formats. Some of the information is gonna be the same, some other is gonna be different requirements according to the company. This is like laboratory requisition forms, or radiology forms, or referrals. Each company has customized their referrals depending on what is the specialty. Well, for these private insurances, they have their own requirements. They're gonna have all these blocks right there to enter the information, but it's gonna be tailored to that particular, or customized to that particular insurance. So that's how it works. Now we can use the CMS 1500 because it's a very common form. But again, it's gonna have the name of the insurance on top of that form. So that's basically what it is. So what is it that these commercial insurances covers? Well, all depends on the plan. What plan do you sign for? If you want only medical expenses, that's what's gonna get. If it is individual, or if it is family plan. Remember, if you get an individual health insurance and something happened to your family, that's not gonna be covered because you didn't get a family plan. Remember, these commercial insurances are the ones that your employer is gonna offer you. Your employer is not gonna offer you Medicaid, that doesn't apply. Because if you're working, then it's totally different. So that's basically how it is. Now you want dental, you want vision. Well, you gotta select those programs with the commercial insurance, and you have to pay a higher premium for that. So that's basically what it is. So the commercial insurance, private insurance, is the one that your employer is going to contract with to offer you health insurance if that employer qualifies to offer health insurance to their employees. Remember that not every single employer is obliged to offer you health insurance. Remember, if you have less than 25, some companies, some states requires not 25 or 20, they require 50 employees. Then after that, you will be obliged to offer health insurance. Later on, we're going to talk about another insurance that works for those small businesses, for those organizations that they do not have, um, enough employees to be required to offer health insurance. Let's just put it that way. For now, we are just covering this commercial insurance. So again, we're going to talk about another term that is very important for you to know, just in case comes in your national certification, which is, remember, fee for service is also known as indemnity. So when you see the word indemnity, means fee for service. So this is the insurance that is going to cover for services, whether it's in a hospital, you're being hospitalized, whether it's the outpatients clinic, your primary care physician, or your dental, your vision, or your eye doctor, if you want to say it like that, your dentist. So if it is covered under your plan, that's exactly what it's going to be. That's what's called fee for service. Or, again, indemnity insurance. So indemnity, fee for service, remember, they're going to pay more, they're going to reimburse more money to the provider for services provided to their clients due to the fact that they are paying a higher premium. So that's basically how it works. So we need to understand these terms because if they come in an exam, so we know exactly what they're talking about. So that's commercial insurance, fee for service. Let's talk about this commercial insurance and this little issue about high risk pools. Now, remember that, when a client has a pre-existing condition, sometimes, these insurance companies, well, it's not sometimes, most of the time, they're going to charge you a higher premium. That's basically what it is. Because it's already a high risk pool. So this is patients that are in a high risk, have pre-existing conditions. So the insurance have to pay more for these client services because they already have a condition. Now, something that changed was after Obamacare. So Obamacare is this plan, is this organization created to, lower the costs and to stabilize certain or rates that these companies were charging to the patient due to the fact that they have pre-existing conditions. So now they are regulated. They cannot charge more for a patient who has a condition. So let's say they have diabetes. They have some renal disease and I'm taking lots of medication. Maybe I'm getting dialysis. All that is very costly and that has to be done, very often. So your insurance company cannot, increase the premium of your health insurance just because of the fact that you have a medical condition. So how are you going to level that? Because for those who do not have medical conditions, then it's kind of, they don't have medical conditions, they pay the same premium as those who do have the condition. So kind of balance it out for them. So that have changed a lot since the Obamacare came about, because that was the whole purpose, trying to get insurance for everyone. Because even though if you were working in the company and you have a pre-existing condition, you were, you were supposed to pay more, but that have changed. So that's basically how it is. So if, once again, these are for patients or clients who they apply for insurance and they cannot get coverage because of the pre-existing conditions. So that's basically what it is. Now they have to get an insurance from here, and another insurance covers this part, and another part. But how are they going to get all this money? Well, it's very expensive. So this is what is called the high risk pools. People who has, this pre-existing condition that have problem getting insurance because they are working, they are making certain amount of income, so they do not qualify to get Medicaid. And if they are not over 65, they're not going to qualify for Medicare either. So they have to deal with these commercial insurances. And remember, these are for-profit organizations. They just want to make money. They don't care about what the conditions that the patient has. If they don't have conditions, that's good, because you're paying me money, but you're not using services. But if you have the condition now, you would put on the spot. So that it was a problem. Managed care. Now here is where I don't want you to get confused. Remember, managed care applies for, governmental, that is how it's controlled. But also, commercial insurances join the managed care. So how they do it? They want to recruit, they want to enroll large amounts of clients from the workplace. But then the employer is going to negotiate with them. I said, okay, if you give me a good rate, I'm going to give you all these employees that I have in my company. So the insurance company is not going to charge like the individual rate that they will charge if it was someone who wants to enroll individually. Now I'm giving you a bunch of people. I'm giving you 40, 50, 60, 100, 200, 500 people. But you're going to give me discount. That's how, the employers negotiate with the insurance company. And they create this managed care. So that's basically what it is. Because they want to reduce the cost of the services. And besides, I'm giving you all these clients. Some of them are going to have pre-existing conditions. Some of them are not going to have conditions. But I'm going to pay you for each one the same amount of money. Remember, this is like, these Medicaid HMOs clients. Well, the doctor receives them because you have to get quantity. We have a lot of those clients, so some people just take them, even though if they get paid some capitated rate, very small amount of money. But for some medical doctors as well, I'd rather have this small amount of money than not having anything at all. So that's how it goes with this managed care and these commercial insurances That's what you see United Healthcare, Blue Cross Blue Shield as part of the managed care, as part of some programs that, certain clients, certain patients can get, including those who are under Medicaid, because they make arrangements with the government, they make arrangements with the employers, but once again, they contract, but they get less money. It's not a capitation. For these private insurances, they don't get a capitation. They reduce the rate that they're going to charge if they were, they were enrolling individual policy holders, but because I get a lot of them, I'm going to give you a discount. So that's basically what it is. Think about when you go to the supermarket and you buy things, individual things, they're going to charge you a lot. But if you go to these other, stores, when you get a bulk, instead of buying, 5 pounds of rice, and now you're going to get 20. So, and at once, you're going to get a discount. That's basically what it is with insurances. The more people that you bring to enroll in this company, then the cheaper that the premiums are going to be. Remember that the employer is going to pay almost like 40 to 60% of the amount of the insurance from their employees. And the employees pays the balance. So every month or every paycheck, they're gonna deduct money for your private insurance or for your health insurance, whatever you want to call. We're not talking about Medicare, that's another one. They deduct Medicare, but you're not using it until you reach 65. So that's how it works. So it's very important for us to understand how these commercial private insurances work. One of the things that you always have to keep in mind that the premiums are very high because this is private companies offering health insurance. We have this association health insurance. Now, pay attention because this is what I was telling you before. So let's say that we have a small company or some freelance employee or, small businesses. They cannot offer, health insurance to their employees because they have less than 20 or 25 or whatever the requirements by that particular state in order for the employer offering health insurance to the clients. So in this case, what they do, that's what is called an association healthcare insurance. Because small organizations, they gather together and as a group, they purchase the insurance from these companies. There are different small businesses. That's how it is. Because they are not obliged to offer health insurance if you have less than a certain amount of employees. Well, they gather with other organizations, other businesses. I have 5, you have 10, I have 5, 7, 3. Okay, let's get together and we're going to pay for the insurance as a group. That's called an association. See, this is a lot easier because it's not easy for you to pay insurance for 3 people on your own. Because then it's like paying individual insurance for those employees. So that will be too much money. And they cannot afford it because they're not making too much money. They are small businesses. So for that reason, they came out with this association health insurance. So that is how it works. So it says right there, by joining together and increasing the number of participants, because that's the key, to have more employees that is going to be being enrolled to this insurance, the insurance is going to give you a better rate. Because now you have a large group as if we're, an employer group. So you actually become an employer group, but from different companies that join as an association. So that's basically what it is. So there are different ways that, you can get health insurance. Now, are all these small businesses are gonna get together? No. You're gonna find many small businesses that they don't get into this. They just, abide by the law. I don't have too many employees, so I don't have to give them health insurance. So that's it, I'm covered. And you don't have to. There is no penalty for that. So that's basically what it is. So this is not mandatory. It is if you want it. You wanted to give health insurance to your employees, but you're too small of the business to do that, then you join with other small businesses, and then you create a large group. So that's how it works. So remember, for Medicare and Medicaid, that doesn't work. Oh, we're gonna get together so we can get discount or this or that. No, that actually does
Day
not
Day
work.
now, I would trust that share.
Well, people look at it, yeah, because you made it with the.
Okay, so be careful. Again, turn your microphones off so it doesn't interfere. Because remember, we are at home. I understand that. So important though. So we continue with this association health insurance. Remember, this is important, particularly for the employees, because they're going to get some benefits that otherwise they wouldn't be able to receive, or they have to get it themselves at very high rates. So the premiums would be very expensive and they wouldn't be able to afford. So that's basically what it is important here. So if I have a bunch of, more employees, more organizations join together to get this group insurance, now remember, you can negotiate better rates for their employees. So that works. But once again, not every single small businesses is going to do that. Because that's the responsibility. You still have to pay, because the employer pays 40 to 60% of their employees health insurance. So who wants to pay that? Unless it's mandatory, but some organizations they want that. Because these are organizations that make decent money and they're gonna stay in business. They don't want to lose their clients or the employees. They have good employees, staff. So hey, they're gonna move to another company when they get services, health insurance. So we don't want them to depart. So for that reason, they get together and they keep their employees satisfied. Because health insurance is a huge, need. Because you don't know when you're gonna get sick. And when there is more than one person living on that particular household, who knows who's going to get sick, who's going to need treatment. So that's basically the reason why, these particular types of insurance plans came about. Very important. Now we're going to move to the group health insurance. Now we are going to talk about the employers. This is not the association, because that will not exist if these small companies do not get together. So this is the group health insurance. So your employer, it can be through your employer, unions. Remember the unions, which are representatives of the workforce that have some type of accreditation, some type of authority to protect the employees. And if they have a union and there is no good insurance, they can fight for that. Well, not every single union is the same or it is good, but there are good unions there. Remember, the unions not only advocate for the employees regarding health insurance, but keeping you on your job, just in case they're gonna fire you. Fighting for, your salary to get an increase, to get less hours, to get sick days, to get tuition reimbursement for the family, for the employee, better rates on insurance. So that's basically what it is. So there are many organizations that can participate with the employee or staff workforce to get these rates reduced. So that means that it's not that they're going to reduce it from the side of the insurance company. No, they're going to request that the employer pay more, that the percentage of how they participate paying for the employee's insurance be increased. So if it is increased, then the employees part of money that they have to, they have to withdraw from the salaries is a lot less. So that's how these unions work. Well, we're not talking about unions here, but it's just the way, large organizations have this group of employees that, has some type of association to assist the employees to prevent, abuse in the workplace, any type of abuse. So that's basically what it is. So this will be mostly paid part by the employer. They pay the premium. Remember that here, the co-insurance, the deductible and the co-payment, those are responsibilities of the patient or the client. The employee, let's put it that way. So that's how it works. So if you work for a company and they offer you health insurance, they are group health insurance. Remember, group is because they have all this amount of employees that that they receive health insurance. And because they have lots of employees, then they're going to get a discount from the insurance company. And it is private. So you get better services than the services that, the government sponsor. Other types, of services that might not be covered. These group health insurances, generally, if you are not part of an HMO, then you don't need a pre-authorization. You don't need a referral to go see a specialist or to change your doctors. So remember, these are the advantage for the patient or for the policyholder, for the employee, because we're talking about group health insurance. But if you have that, you have choices. The advantages that you have these private insurances that you don't have to get, pre-approval. If the medical doctor requires something, they're just going to schedule with the specialist or with the procedure and then file a claim for those services. Whereas if you have this governmental insurance, particularly Medicaid, you have to go through your primary care physician. If they determine that, if the insurance determines that, they don't want to pay for those services, that they don't encounter these services to be a need, so they're just not going to prove it. And the patient or the client or the employee is not going to receive it. So that's basically how it works. So it has lots of advantage. Remember, you are not going to have a gatekeeper with the group health insurance. Because the only ones to have the gatekeeper are these HMOs, particularly the government insurances. You will be controlled, you will be limited of the services that you can receive. So that's basically what is at stake. So you have to look at the advantage and disadvantage. But then those insurances, you don't pay. You don't have a premium, you don't have a copayment, you don't have a co-insurance, you don't have a deductible. But then the services are limited. And you have to ask permission. It's like when you live at home. You got to tell where you're going and you have to ask for money and all the stuff. Here you are more independent, but yes, the premiums are higher. So that's basically what it is. So it has advantage and disadvantage. One, you get the insurance for free, but then you are limited to get the services that you probably need. The other one, you get the services that you need, but a higher price. So you have to pay for it, have to pay more. So that's basically how it works. So this is the employer-based group health insurance. Covers all employees, regardless of what conditions they have. Remember, that is the most important thing. So the insurance cannot say, oh, you became sick now, so now, or we're going to increase the premium, or we're going to drop you from the insurance. You can't do that. Remember, if you have a pre-existing condition, they're going to enroll you, and that is it. They cannot give you trouble for that. And if you become sick when you are working, well, they can say, well, we're not going to pay for your services. You're supposed to be healthy. Well, what is the purpose of having medical insurance, right? If I'm not going to get sick, what should I get it? We get it because we don't know. Maybe we already have conditions, or probably we don't, but nobody is absent of getting or becoming ill. So that's basically what it is. Because remember, the reason that is stated right there is because back in the days, it was like that. If you have medical conditions already and you're going to enroll, you're going to pay a higher premium. You were already enrolled and you develop a medical condition in which, the insurance have to reimburse the medical providers more money for the services because you are requiring more medical procedures. Then they increase your insurance, or, if they increase your insurance, you don't pay. So then immediately says, okay, we're going to cancel the health insurance with you. They can no longer do that. So that's basically how it works. Things have changed, but still, remember, the problem with these higher premiums has not gone away. And it's gonna get worse. Because as time goes by, believe me, Medicare, Medicaid, all those services are gonna be wiped out. So the only thing that is gonna be there is gonna be this private insurances. Just like a long time ago, that's the way it was. So if you have money, otherwise you have to work, and you have to work in a company that offers you health insurance. Other than that, it's going to be very difficult for individuals to use the health service. So they're going to end up in emergency for almost anything, like if the emergency was the doctor's office, until they change the policies to go to the emergency, because that will come as well. So believe me, things are changing and are changing dramatically because health insurance is very expensive. Now, if you're following now the new, chief in charge of this country, they want to get rid of Obamacare. So all these plans, all this Medicaid, it's going to go away. And for Medicare, there's no money because the government is not putting the funds to support the services for Medicare. And if they don't, give funds for Medicare for someone who has already paid, because this is not something that you're getting for free. You already pay in advance. Because if you work, money was deducted from you. If they're gonna remove that, if that's gonna disappear, can you imagine Medicaid and nobody pays for it by, the government through the taxpayers? It's gonna be really tough. So we gotta get a job where we can get, these employers pays insurance because things are going to change, believe me. So limits exclusions for existing conditions, remember? So now health group insurances cannot disqualify you. Remember, cannot exclude you, cannot disqualify you just because you have a pre-existing condition. Because it was like this before. This was really, really difficult. So now, again, it's not that you cannot discriminate you, but the point is you cannot increase the rate of the premium just because you have. Because if you have money and you pay whatever they ask you, well, that's not an issue. The problem is that if I have medical conditions already and I want to join your health insurance, then they require you to pay a double what a regular person will pay. So if someone was paying $5,000, $7,000, now you're going to pay double, $10,000 or $40,000. So if the person doesn't have all that money, how are they going to join a health insurance? That's going to be very difficult. But that was changed again. Things were good for a while, but things are going to go back again to how they started. Because remember, the new administration wants to remove health insurance. Sometimes people don't understand when they talk about no health insurance for this. Is the money from, the government. They not that money that is supposed to go to pay for medical health insurance, medical expenses. Now it's going to go for other things. So that's basically what it is. For defense, I don't know, something else, but not in education as well. So all those grants, all this money that some of the students get, I got some of the grants when I went to school. So all this money that, that it was put aside for education, health, and some other things no longer is going to be available. So then these insurance companies that I pay or that are funded by that, and these educational programs that are funded by that money that was put aside for education and health, now it's not going to be there. So how that's going to function? That's going to be closed. That's going to be canceled. So that's basically what it is. So we got to kind of think about it. It is portable. Now, this is another thing that, health insurances have, a good thing that they have. So it doesn't matter when was instituted, when the law was passed, something like, no, portable means that, your insurance, you lost your job. You quit. You were fired. Not a problem. You're gonna get your insurance at least for a period of 18 months to 6 months. So you can move with your insurance to another job. Or you can keep your insurance until you get another job. So that's basically what it is. So that's called portable. That's what we have HIPAA, because HIPAA stands for Health Insurance Portability. So portability means that my insurance that I have in this company, if I move to another one, I'm going to bring it with me. And the insurance cannot increase my premium just because I move from one place to another. They cannot cancel my insurance either. They cannot change anything about my plans in my policy. So if I have dental, if I have vision, if I have paying these medications and these procedures, this insurance is going to move to the next job exactly the same. Because that was not like that back in the days. Somebody moves from one job to another, you lose your job, you get completely disconnected. So remember, this affects people who already are, have some pre-existing conditions. They taking some medications or receiving some treatments. You can't stop. Okay, so I lost my job, I quit, the company closed, what I'm gonna do? What I'm gonna do with my medical condition? Because we're talking about health insurances. So according to these laws, employers should not lose their health insurance. Not whatever it covers. Remember, if it is a family plan, still covers your family and everything. Nothing will be removed. It will continue. The premium do not increase either. You will be paying the same amount of money, the same plan, the same benefits you're going to be receiving. So that's basically how it is. So it is very important that we understand this, because if you start working and your employer offers you health insurance, then you know how it is. Remember, it doesn't matter if you get fired, you still cannot lose your insurance. But you have to make arrangements for that to happen. It's not done automatically, but you can keep it. So that's basically how it works. So here is where COBRA comes to play. So COBRA stands for the Consolidated Omnibus Budget Reconciliation Act. So that is COBRA. So COBRA is the continuing or the continuation of coverage. So remember that we were talking about prior that the insurance is portable. Well, it is portable because according to the laws, if you lose your job, then your insurance, you have to contact this organization. That is COBRA. COBRA is an independent organization, remember. And what they're gonna do is you're gonna transfer your insurance, your group insurance, your private insurance, your employer insurance, you're gonna transfer it to COBRA and you're gonna pay them, and COBRA pays the insurance. So you cannot lose your coverage. Again, this is gonna happen for a period of 18 to 36 months. Let's say 36 months is 3 years. That is a long time. So how can you say that in 36 months you couldn't find a job? Because after this 36 months, now you don't have insurance. But you're gonna be covered up to 3 years after losing your job, or quitting your job, or being fired from your job, or the company closed. So that's basically what it is. So COBRA makes sure that you're covered, that you continue with your insurance. So this is the organization, this is like the middleman. So your employer have to tell you, okay, so we reduce the amount of hours, you no longer qualify for insurance, oh, we are downsizing, we're gonna lay you off, you are fired, no worries about your health insurance. Fill out these documents, and that is COBRA. They have to inform you. See, employee must be offered COBRA continuation coverage. By who? By the employer. Because the employer knows that he or she no longer gonna need your services. And if you remove yourself, if you quit yourself, it's because probably you have something better. You move into another company, so that's not gonna be an issue. Because you're already gonna transfer your insurance when you are enrolled in the new job. They're gonna ask you, do you have insurance coverage? What is it? What's the plan? So you can move it directly. But if you are in the middle of nowhere when you haven't found a job, well, somebody fired you, how are you gonna find a job? The company closes, they lay you off, you weren't expecting that. But sometimes we hear things, and that's when we should be prepared. If you hear that they are laying off people, things are not going well, be prepared. Now, again, sometimes you might be working in a company where they don't offer health insurance. So then there is nothing to carry on with you because you didn't have health insurance. Unless you have it on your own or other type of insurance. If you have Medicaid, no worries, but you weren't making enough money, that's not gonna end, whether you have or don't have that income coming in. It's for these commercial private insurances that you have to be prepared, particularly if you have a pre-existing medical condition. We said you or a member of your family, your dependents. Remember, there are many situations in which, the family depends on one income, and this person is the one that it is the policy holder. But if there are minors, remember, there's always there the government insurance. So you have to, use all the benefits possible if something like that happens and avoid things from happening, right? So particularly that. So if you lose your job, once again, this is the reasons why COBRA is offered to you to continue your coverage of your health insurance. So within a period of 45 days, you will be sent a notification by your employer. So your employer has to give you that information because you need to keep your health insurance. Remember, if you have medication that you're taking, procedures, you need to get this COBRA insurance. So if within certain period of time you do not sign up for COBRA, you will be disqualified. So it says right there, you have 60 days to respond to the election notice and apply for COBRA. So if you don't, then you will be losing your insurance altogether. So that's basically how it works. So COBRA is very important, middleman in between the insurance and the employee in situations where the employee, for some reasons, no longer, works for the particular company that was offering health insurance. So that's basically how it is. So be careful. So again, you might have some, no, depends on the plan, you might have some limitations. Every single insurance have limitations, but private have less limitations. Limitations happen in a private insurance or a commercial insurance when you select a plan that doesn't include these particular benefits because you don't want to pay more. That is it. Whereas the government insurances, then they give you limitations because you're not paying. And the limitations are going to be the same for everyone. Here is that if you pay more, if you get these services, oh, I want dental, oh, I want visions, I want this particular procedures specialists to be paid. So then you're gonna have to pay more. So the premium goes high. Certain medications, we will discuss that once again when we get to pharmacology, because we're gonna talk about brand and generic medications. And most of the medication that usually the patients qualify for in certain situations, particularly if you have Medicare or Medicaid, it will be generic medications. But not every single medication has a generic. So for that reason, you have to get the brand. And the brand is very expensive. And some insurances do not pay for certain brand medications. So that's the drawback of these insurances. Think about your phone service. It's the same. If your plan includes, unlimited, everything, well, you're gonna pay more for the premium of your service. If you kind of limited everything, restrict to certain, services, then it's going to be cheaper. See, I used to have, a plan. I paid for the plan because I was here most of the time. So it was expensive because these phone services are expensive here. Now I don't have a plan. I have a prepaid. Of course, I'm not gonna give my money away. The money I use it for other purposes, to eat, to buy things that I want. Why? Because I keep on traveling all the time, and I live not for a week or a month. I live for at least 2 months, at least. Sometimes I go away for 6 months, for a year. I'm not gonna pay plan. Remember, when you're on a plan, it's a pain to try to get off of the plan. So I'm not gonna pay for those services. So I have a prepaid. When I come back, if they remove my number, I don't mind. I just get another number and start another service. No problem. But I'm not gonna pay them for some services that I'm not using. That will be a waste of money. So again, same thing happens with these health insurances. If you do not need certain services, don't apply for it. Don't get those plans because it's going to be more costly for you. If things change as time goes by, then you add those services to your plan if you have a commercial insurance. So that's how it works. You don't pay in advance thinking, oh, well, just in case tomorrow something is happening to me. So then, I have insurance. No, it doesn't work that way because that money is not retroactive. Money that you already paid is gone. That's not coming back and say, oh, well, you didn't use those services before. So, guess what? Now you got sick and you paid before, but you weren't sick. Well, we're going to compensate you for that. That's not how it works. Insurance do not work that way. That's business, remember. This is not retroactive. This is not that you work for 3 weeks, that you get paid one and then, oh, sorry, we're going to pay you retroactively for the time that you work. But you did work. That's a different issue. Not for insurance. So only pay for the services that you actually need. Only request for those services when you have health insurance. Remember, it is very expensive. Your employer is going to be paying a percentage of that premium. You have to come out with the balance. And the higher the premium, the more things that you have in your plan, the more expensive your part is going to be. So that's basically what it is. I'm telling you this because I have someone that I know, and she was like, oh, no, I have my employer give me insurance. I said, no, they're not giving you anything. You're paying for it. They pay part. No, I don't pay anything. I said, okay, that's fine. Check your invoice or your pay stub, or when you do taxes, it's gonna be there. And your pay stub is everything. They tell you how much money they deducting for Medicare, even though if you are 20, start getting Medicare at any age that you start working. You pay for the city taxes, the state taxes, Medicaid, Medicare, and if you have a private insurance, so you're paying for that too. So again, we have to read and learn about these insurances for ourselves. And when your patients come to your office, now you know, because that's another one. They have a group health insurance. The card reads on the card, is written there. It said group ID. So as soon as you see group, immediately you know that this is the employer. This person works. Or it is dependent on someone who works. Because then you're gonna read the name on the card. And if the name on the card is a male name, but the person who brings the card is a female, then it's a dependent. So that's how you're gonna understand. So that's how you know how you're gonna select which block you're gonna mark for the insurance that the patient has, because this is the insurance that the health insurance is gonna reimburse the medical provider. And later on, we're gonna talk about primary, secondary, tertiary insurance. All these, comes to the same thing that we have to understand when each one of these insurance, whether it's governmental or private insurance, which one is considered primary or secondary insurance. Because if we don't do that, believe me, that claim is going to be rejected. And it's going to be a waste of time because we have to make the corrections, resubmit it again, has to be processed again. And if we are lucky, probably goes through. If it's not, they're going to come back to us unpaid. So that's basically what it is with these insurances. Now, we're going to talk about a little, this is insurance, but we're going to talk about disability insurance. So disability insurance happens for any reasons, and there are different types of disability insurance. If you own a car, you probably have disability insurance on that policy. If we're talking about health, then in your workplace, they are going to give you, or your insurance policy also have a disability part to reimburse services if something happens to you. You get injured on the job, or you have a condition and that condition worsens and you have to be out the job for some period of time. Again, it can be temporary or it can be permanent. Who's going to cover for those services? Who's going to cover for, these lost wages? The disability insurance. So that's basically what it is. So remember, you can get disability just because we're not talking about here directly workers' compensation. Of course, that's the one that it will be, put in place in this case, that disability due to injury. But we're talking about in general, you will not lose your wages. You will not have to pay for medical expenses. So that's basically what it is. You will be receiving your salary, plus you will be compensated for services provided. So you don't have to pay, regardless whether it's an injury or not. Remember, you can get sick, but this is something that happens to you that's internally. You just become sick. And you cannot come to work. You're not going to lose the money. You're not going to lose your wages. You're going to get paid. And if you go and receive medical attention, medical care, disability insurance will pay for it. That's something that, your employer, all these insurances also offer. There is always different types of insurance included with your policy. So you need to know if you have that. But in your job, because it's a private insurance, you definitely will have it. So that's how it works. You will not lose your job because of that. You're gonna go home, you're gonna go to the hospital, you're gonna go to rehab, wherever the medical doctor decides according to the diagnosis, the conditions that you may have. You just follow the medical's, advice, and this information will be passed to your provider through you. If it is workers' compensation, through your attorney or the insurance that they pay for. But that's how it works. So how do you, what is called disability? Let's just put it over. What qualifies as a disability? So right here it says disability benefits are usually paid if an individual goes through the following. Has been unable to do the regular or customary work for certain number of days. All depends of the type of policy that you have in your organization. The person was employed when disabled. So it's not like, you just started the job. You don't qualify because you already have to meet certain requirements. You have to be working for some time over there in order for you to qualify for this disability. So again, they're going to compensate you for, wages, loss, and medical expenses. If you need equipment to move around, like crutches, wheelchair, walkers, rehab, is going to be included with this disability benefits. Remember, this disability benefits is not just the workers' compensation, because we covered that. Workers' compensation is you got injured on the job. Here it is because you have a condition. And that's the reason why, the insurances wants to charge you a higher premium when you have a pre-existing condition, because they know that these conditions are not going to get better. They're going to get worse. And if they get worse, the insurance have to reimburse more this policyholder for all the visits to the medical doctor, all the medications, and probably the time lost at work. So that is the reason why all these premiums, have, a lot to do with, whether you have conditions, prior conditions. That's what pre-existing condition means. You start working here, but you're already diabetic, you already have high blood pressure, you already have problems with your heart. You've been seen by medical providers. You already have arthritis, you already have back pain, you already have all these conditions. So then you're gonna be, going to the doctor a lot. Because they know already that going to the doctor a lot and getting all these procedures is gonna be more costly. Well, they're gonna add it to your premium. So that's basically what it is. So you need to be an employee. Someone who's not an employee from that organization, you can get disability. Has to be someone who already been working there. Okay, has disability insurance coverage. So you already have disability coverage, because if you don't, remember, if you have an insurance and your policy does not cover disability, then that's another issue. And you have a medical condition, so then you have to pay the balance, all the services that are not covered because you didn't pay for disability, then. So that's basically, because remember, this is not a condition that the patient developed due to the type of job that the patient is performing. It's not due to an injury, no. Every single organization, every single person, depends on the job that you're doing, requires to have a disability insurance. Car insurance has to have a disability insurance for you and for other people that you might injure if you run into this situation. Medical providers, they have a disability policy, which is malpractice. You will be covered by the doctor that you're working for, or the hospital, or the clinic. So if you injure someone, you do something wrong when you're doing a procedure, so patient is going to be compensated because these medical providers, they have a policy, disability, malpractice. So that is how it works. And if you drive in a car, well, you have to have disability. And depends on your plan, they're gonna pay you a certain amount of money for your benefits, for your medical care, and money for the person that you injured if it was someone else. You also have to pay for the damages. If the vehicle was damaged, the car was damaged, you have to pay for that, those damages. That is liability as well. So disability from, for the person who's driving, if you are at fault, then you have to pay. Your insurance pays. If it was your fault. You are the one who, ran, the red light or the stop sign, or you were speeding. And, so lots of things can happen. So for that reason, these insurances have all these other, addendums within for different type of situation that might occur in advance, and they charge you for it. So these claims needs to be processed right immediately after, this situation happens. But remember, if you don't do it, then the insurance might deny paying for your services or reimbursing you for, lost wages. So we need to understand this. So disability insurance has the license provider complete the liability medical certification documents. So the medical provider, the medical who examines you, he is the one or she is the one who has to certify that you are disabled, that you consider disabled, and what type of disability you have. Is that temporary? Is that permanent? Can you go back to work doing a light duty work? Remember, your employer wants you to come back and do whatever type of work. Because we don't want you to stay at home, just getting money. Now I have to get someone else to replace you and pay the person too. So that's how it happens. That's why this is another thing that when you apply for a job, it's not that they're going to ask you, because they never ask you, because that's discrimination. They're not going to ask you, okay, do you have any medical conditions? But they found the ways to find out or to figure it out. And some of the times will not give you the job just because of that. Not because they're going to pay more premium for you. No, the premium is the same as anyone else, with or without pre-existing conditions. But they are thinking about you missing days, going to the medical doctor, staying at home, calling in sick, because you already have a pre-existing condition. So this is not just for the insurance, but for your employer as well. You don't want to hire someone who's calling in sick all the time. That's not what, that's not the reason that you hire someone. You hire someone because you need it for the position. The person needs to, accomplish certain tasks. Now you're not there to do it, but I have to pay you for it. So just think as an employer all the time. And then you think as an employee. Because that's how it works. Think about what your boss would do. Think about what you would do as a boss versus you being the employee. So you have to be very empathetic. Remember, you have to put it on the other person's situation. And that's how you're going to understand all these issues about, being hired or not hired, being given insurance or not. So again, if you're not qualified to give insurance, you're not obliged according to the government because you don't have enough amount of employees under you. So then you don't give health insurance, period. Because they know what's going to happen. They know that if something happens to you, then you're going to have to keep on paying these people outside of work, probably forever if they are, declared permanent disability. So think about that. After certain ages, certain people don't get hired. It's not because they don't know how to do the job. Remember, bro, you have more experience than anyone else. But they're not thinking about just the experience that you have. They're thinking about some other things that might arise because of your age. Remember, as we age, more things start happening to us. Not in a good way, because we are collapsing and more medical conditions are going to arise. So think about it. So very important to understand all this and not take things personal when something happens to you. If somebody discriminate me because of the age, they're not going to tell me. But as soon as you send your application and they call you and, they look at you and says, oh, no, this person is too old already. Now I need someone younger. This probably is going to get sick. I have to pay insurance. I have to pay disability, blah, blah, blah. Well, they have already made their mind. They're not telling me anything, but that might be the reason. So they're going to tell me, okay, we're interviewing other people, so that's fine. I'm not going with the mentality that I have to get the job, but think about all the issues that go along with, being as an employee and all the services, all the benefits that you get through your employer. But all, the risks that, your company is going to be put in because of, your medical conditions or your age. That's basically how it works. Eligibility for disability benefits. So who qualifies to get disability benefits? Claiming or receiving unemployment insurance benefits. So ineligibility, remember, you're not eligible. If you are already claiming or receiving unemployment insurance benefits, you're not qualified for disability. Period. That's the law. Disability occurs when committing a crime that resulted in a felony or conviction. So you got injured because you were doing something illegal. You were not doing something on the line of your duty. So they're not gonna be responsible for you. So that's basically what it is. So people has to be very careful, particularly those who has a very, bad temper, that they get very upset. Particularly those drivers that get, very upset when someone says something or someone blocks them or someone passes by and, faster than them, race roads. So you have to be very, very careful with this. Receiving workers' compensation benefits, a weekly rate. So if you are already receiving workers' compensation, you cannot apply for disability. You're receiving workers' compensation, you have to wait until, all the doctors and all the exams and all the stuff proves that you need disability, but that's through your, workers' compensation. You cannot get workers' compensation plus disability, separate disability for your conditions, medical conditions. Doesn't work that way. So if you're already being paid for some type of disability, you're receiving some compensations, you cannot apply for disability. You're already getting money. So that's basically what it's trying to tell you. If you are in jail or prison, or you are on probation, so you do not qualify because that's crime. If you fail to have an independent medical examination when requested to do so, then you do not qualify. This is important because sometimes, the patients, they don't want to go and get certain exams. Let's say that you get sick and you said that you have this and you have your own primary doctor and the doctor, just wrote a letter that you have this and you cannot go back to work. Your employer is not going to buy that. Your employer is going to say, okay, I understand that. So I'm going to send you to one of our doctors. I'm going to send you to this particular doctor to follow up with you, to do evaluation. It's like getting a second opinion, but this is the employer or the insurance. Because in other words, I don't believe you. This is your doctor. Your doctor can sign almost anything for you. So we're going to send you to get a second opinion, someone else to confirm whether you are actually disabled or not. So if you fail to do so, then you disqualify. So you do not receive anything because you're not following the proper protocols, the proper procedures. This is not like I'm sick and I'm home and I cannot go work and that is proof in it itself. It doesn't work that way. So if they request you to get evaluated by someone else, you need to do it. And according to those results, now the insurance company, the part of the disability of the insurance, is going to determine whether you can be granted or not disability or not. So this is very serious. This is not something that, you just tell them, I'm sick, I did this, I did that, I don't want anything else. These are the papers that I have. No. You have to follow, the protocols. When does this disability claims begins? Because that's important. When can you start, completing this disability claim? So disability payers calculates an individual's weekly benefits amount using a base period. What is the base period? Usually 12 months. And those 12 months are divided by 4 consecutive quarters. So remember, a month has 4 weeks. So that's how they're going to be calculating this. We're not going to be worried about this because this is not what you're going to be doing, working for a disability, insurance or anything like that. It's just for you to understand that they have their own protocols to give you the disability, how much money you can get every week, every 2 weeks, or monthly, because they have, a formula to do that. So that's basically what it is. It's not what, probably your attorney is requesting for. This is by law. And every single money that you are going to be paid is going to be taxable. At least until, they determine that, that your disability has been approved. So again, they tax you for almost everything. It's not that you're going to get a sum of money and that's going to be exactly what you're going to get. No, you're going to pay taxes on all that money. So things to know, right? Very important for us. See, this is like someone who wins the lottery. You think that, wow, I hit the lottery, I hit the pot, I get $2 million. No, you're not getting $1 million, $2 million. You're gonna get probably half of that. Because everything else is gonna go on taxes. Every penny that we earn is gonna be taxable. Whether it goes for disability, whether it goes for malpractice, whatever money you receive, that is not 100% what you're gonna get. So that's how it works. Liability insurance. So let's read a little bit about what exactly, in more simple terms, means, particularly for the medical professionals. Remember, when it comes to negligence, malpractice. So in the medical industry, professional liability is known as medical malpractice. So what does medical malpractice covers? What is the coverage? Well, this is for the providers that, fail to follow the standard of care for the patients. Something went wrong, that's it. Patients suffer some consequences. Now you are going to be liable. This is not disability, this is liability. Liability means responsible. Who is responsible to pay for the damages? So that's liability. And every single insurance has liability, has disability, liability. Disability to pay for the time loss at work. They're gonna pay you for, the services needed, health services. Liability is who is responsible, under which circumstances. So if a doctor fails to follow up after patient has a major surgical or major surgery, meaning one of the most common complications that happens after surgical procedure is an infection. So if something happened, the medical doctor did not follow through. Remember that we discussed this back in other modules. That's called abandonment. So every single time that your patient has a procedure, someone from the office must call, find out how the patient is doing. Somebody has to follow up. Patient has to be asked to come back to the office or to the surgical place when they got the surgery. Because when you receive these post-operative um, recommendations, part of those is to inform your medical provider if something is not going right, if something changes in your health, whether you're getting better or you're getting worse. You are giving medications to take. We have to make sure that we contact the patient to find out whether the patient is following through all these directions or these instructions. If we don't, and the patient becomes sicker, then we're probably going to be liable for it. Now, we talk about this during law and ethics. Remember, in order for the patient to sue us for negligence or malpractice, they have to meet the 4 Ds. During, the relation, direct cause, and damage. Now, remember, direct cause is very important. It was because the doctor was the doctor's responsibility. Well, yes, in this case, because the doctor did not contact the patient, did not follow the patient after the surgical procedure. Oh, I did the surgical procedure, I got paid for that, so, and that's it. Next. No, you have to contact your patient. That's still your patient. Because if something happened to this patient during this post-operative recovery, you're going to be in trouble. Now, if it was to follow, the patient did not want to take the medications, didn't take the medication, didn't go back, didn't return to the follow-up, even though if they were called, contacted, they didn't do it, then that falls under, the patient's responsibility. They are liable, not the medical doctor. But that, is going to take some time to be discovered, probably during the trial. And that's going to be costly. That's going to be time consuming. But in general, medical providers needs to have a liability insurance. Car owners must have a liability insurance because that will be for you and for whoever is involved and whoever is at fault. That's the one that is responsible. That's why when you hear people having, car accidents, something like that, it is okay to call the police. Why? Because, they're going to determine, and they're going to get all this documentation from both sides. So if something happens, someone from either side is going to be liable. Someone's going to have someone's insurance have to pay for it. And if you don't have insurance in your car, now you're in big trouble. You can go to jail for that. So that's basically what it is. So you have to have liability insurance, particularly in the medical profession and anything else. But we are in the medical profession, so that's how it works. So remember, liability means responsibility. You are responsible. So you have an insurance for all your wrongdoing. If you're liable, if you do something wrong, you have to pay for it. So that is how it works. So we need to understand these terms. Remember, disability is one thing, liability is another thing. See, liability insurance continues. So if a third party is responsible, it's not you, it's someone else, so then the person will be responsible. That person will be liable for the injuries or property damage. That's basically what it is. That is in the case that, if you are a medical provider and you were negligent, you didn't do what you were supposed to do, you failed to meet the standard of care, you omit certain procedures because you thought that it was not necessary. If something happens to the patient, well, then you're going to pay. But if it is something else, like a car accident, then a third party means my insurance is not going to pay for it. The other party insurance is going to do that. So we go back again to this CMS 1500. When you're filling out this form, there are some blocks that they ask you if the injury that you have is due to, work related, it is a car accident, involvement, or else. Because that's when we are going to be determining whose insurance going to pay for the damages, the injuries, the loss of the wages of the person involved, or if the person dies, who's going to be paying for it to the family members. It's not like, you got into a car accident and then, oh no, you are the one to blame. No, they're going to find out who was at fault. Because remember, the person who was at fault is the person's insurance that is going to pay for it. This is not like let's split. No, this doesn't work. That's, it's not fair. That's in order to, to punish, to teach a lesson of this person. That's what every single person who has a car must have car insurance, and which includes liability, disability insurance. And it has to be covered for a lot of money, usually $100,000 and more. So for liability, goes millions of times coverage. So you have to pay a higher premium. That's why people who are recent drivers, new drivers, you have your driver license and your driver license is new, your premium is going to be higher. That's someone who's been driving before and it has a clean record of driving. Someone who's very young and has the license is very expensive. My son just got him a license. They charge me $5,000 per month. He doesn't have no accident. It's just that he's a new driver. He's a liability. He's learning how to drive according to the insurance company. It is young. Goes a little crazy. Speeding. I call him Speedy Gonzalez. Because that's what we do when we're young. Go crazy. So the insurance goes higher. For the medical professionals, depends on what profession, what specialty you have. This malpractice insurance is very expensive. GYN doctors, surgical doctors, the insurances are very expensive. We're talking about $50,000, $100,000 per year. Because they have, they are exposed to a lot of this, liability. versus a medical, medical practice, a family practice doctor, internal medicine. You're not dealing with all these procedures when, you can put the patients at risk or the patient is at risk, not because you put them, but either or. So the insurances are more expensive. So that is what it is. So it is the liability, the one that goes really high. Because, you can tax the unforeseen. You don't know what's going to happen. But we have precedents from other medical providers in the same field. And when they've been sued, how much money they have to come out with. So then the liability is really high. So the premiums are very high. So again, remember, you can even sue another person, another medical individuals. It doesn't matter if it is medical or not. For libel and slander. Remember, defamation. When you harm someone else's business by making, false statements about them or the person who was the owner or the owners. So there is liability for businesses as well. Because that is an intentional, way of hurting those businesses or that person. If you talk bad about someone, it's because you want to harm them. That's intentional. You don't say something bad about me because you just want to, that's not a compliment. So there are different ways of, get insurance liability for many reasons. So businesses, they must have liability to protect themselves because you never know. They can be sued for any reason. So most health insurance contracts state that health insurance benefits are secondary to liability insurance. That is true. So your health insurance is secondary to liability insurance. Because liability means you did something wrong. For that reason, we're going to punish you for that. So you have to pay because you did something wrong. And it's not your health insurance, the one who's going to pay. It will be your malpractice. Because remember, medical providers, all of us, we have health insurance. But we also have a liability. We have malpractice that can be paid by the provider, or if you work for a hospital, they will pay for it. So my health insurance is not going to pay for someone else's services. So that's basically what it is. So if you got injured, you got disability, you got something like that, then your health insurance will be secondary, will never be the primary. But don't get caught up with that. That's not relevant. We're going to see when actually these insurances are considered primary or secondary. Just the way that we talk about when Medicare is considered primary or secondary. So that's basically what it is. So we mentioned already, and we said, this is a private commercial insurance. This is a group employers sponsor insurance. So it's private, it is commercial. So that will always be the primary. So that's basically what it is. Now, in circumstances when there is a liability, of course, the health insurance is not going to be the primary. But they're not going to ask you any of that. If you have questions, it's going to be based on very simple things. Patient has Medicaid and a group insurance. Which one is the primary? So then immediately you know that employers or the private or commercial insurance is going to be the primary. Anything else, whether it's Medicare, Medicaid, is going to be secondary if they have those. Patient have Medicare, Medicaid, which is primary. Medicare, because remember, Medicaid, it will be the insurance of last resort. If you have only Medicaid, well, that's the primary. But if you have another insurance, Medicaid is never going to be the primary if you have another insurance, including Medicare. Medicare, group insurance. Group insurance is primary, Medicare is secondary. The only time that Medicare is primary, because you have two insurances, if you have Medicare and Medicaid. But when it has other insurances that are private, Medicare is going to be secondary. So be careful with that. Because that's something that if you will ask, those are the questions that you're going to be asked. Nothing else. Everything else is for you to understand how this works. When negligence by another party is suspected in an injury claim, the health insurance company will not reimburse the patient for medical treatments or the injury until one of two factors is established. What two factors are established? Okay. Who was at fault, right? So that's basically what it is. It is determined that there was no third-party negligence. Well, you're not going to blame someone else. It was you. So then you're going to be responsible. And the opposite is also true. There was a third-party negligence. It was someone else who was at fault. So then my insurance is not going to pay. The other party insurance is going to cover. So this is mostly when it comes to, accidents, things like that. Or, well, if there is a negligence case or malpractice case, well, it's not that the other person is going to pay, it's that the other person is going to be responsible. So we're not going to pay you. That is the key. If it was to follow the patient that did not follow the instructions, everything was given to them, but they didn't follow through, then it's their responsibility. Well, they're not going to pay us, but we're not going to pay them either. But if it is a car accident, then it's a different issue. Then the part at fault, remember, has to pay the damages, the liability, the disability, whatever happens, that other party is going to be responsible for. They are liable for. So that's basically how it happens with these private insurances. So it's better to understand a little bit how they work, particularly when, we have those insurances. And we are in a situation where, something happens. Because that's the only time that you're going to learn, the hard way. So in the medical, for your exam, suggest knowing which type of insurances your office is receiving. And if they are private, remember, they don't need pre-approvals, they don't need referrals. So that's basically the most important thing, because they pay a higher premium. And the plans that they pay for covers certain services. They are responsible for co-payments in our office, definitely. So just read the card in front, the insurance card. You have to, that's one of the reasons you ask, not just to verify for coverage eligibility, but also to see how much this person needs to pay for the copayment. It's not good to be asking the patient, oh, you have a copayment, oh, how much you have to pay? No, we are the ones who needs to know, but we don't know just because, we see the patient and we hear about the insurance. No, you have to see the insurance card. Okay, so let's take a break, and when we come back, then I'm gonna wrap it up with this chapter, and we're gonna go on a nice long weekend. Okay? All right, so see you later, 7:40. Don't forget. See you then. 7:40. Enjoy your break.
Thank you. Thank you.
You're welcome.